Have you thought about the future of a career in health information? Are you concerned that it may not exist long term, or there is no future in it? Let's chat about it. Hey there, and welcome. If you are new here, you don't know me yet. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified marketable medical coder. As a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've served hundreds of students and helped them transform to become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Consider subscribing to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. And don't forget to hit the bell for notifications of my weekly videos. A couple of weeks ago, I attended the AHIMA's annual House of Delegates virtual meeting. I am on the board of my state component association, or CSA, and that's Ohio. I am also a delegate. There were 188 delegates that attended the meeting from 50 different CSAs. All of the Ohio delegates were accounted for and present. And 10 members of the AHIMA Board of Directors were also present. As delegates, we focused our thinking on the future of our profession and what it may look like in the future and how you can prepare yourself now. You know, there are changes on the horizon in healthcare. The HIM departments and positions of yesteryear are ever evolving. Using the Deloitte Insights article, The Future of Work, as the framework, we discussed several issues in this year's Strategic Pathfinders Breakout session. I have placed a link to the article in the description box. In our session, we discussed the 4 drivers of workforce changes that you should be aware of. Number 1, generational shifts in the workforce. We are in a time where several generations that have different working styles and expectations are working together. As the baby boomers retire, their workplace traditions are retiring as well. Even career paths and the workplace environment is changing. Have you gone to an open concept in your office? And with the COVID-19 pandemic, have you even gone virtual? Number 2, open talent models. Per our discussion in the breakout session, other target models have different requirements, such as new skill sets and where the actual work is performed. One of the skill sets that we thought everyone should consider is data analysis. Doing a quick Google search, data analysis is the process of examining raw data sets to find trends, draw conclusions, and identify the potential for improvement. It is also used to support decision making. Number 3, technology. Technological advances in artificial intelligence, or AI, and cognitive computing are also impacting the way health information professionals operate. This leads to automation of certain job duties. Now, technology is not a bad word. There are several concepts that have allowed smoother workflows and efficiencies in our work. You must be open to learning new technology to stay marketable in our field. Number 4, consumerism. Taking into account the consumer, who in healthcare is the patient, and their wants such as better service, more convenience, and ease in navigating the healthcare system, These consumer wants and demands create opportunities for organizations to identify new strategies for what work needs to be done. Did you know that it is estimated that in 5 years, 95% of customer interactions will be AI driven? In the next 10 years, 47% of US jobs will be automated. Millennials will account for nearly 75% of the overall US workforce by 2025. Now, as you ponder on the future, think about what work can be done by machines and/or robots. Who can do the work? Employees, consultants, and other contract workers. And where can the work be done? On-site versus off-site. And I guess we can even consider offshore, but that's another conversation. Question of the day. Taking into account AHIMA's strategic plan and the drivers of workforce change presented in the Deloitte article, what skills do you think are needed for the evolving health information industry? Let me know your thoughts in the comments. Health information professionals are viable members of the healthcare team, both from a clinical and business perspective. In order to maintain our stock, position, and seat at the table, we must stand ready with the tools and skills to be a part of the future of healthcare. Stay marketable, my friends. Now is the time to prepare for the future. As I always say, don't wish for it, work for it. Right? Right. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. And if you are interested in more information on these tips and others on how to become a certified marketable medical coder, well then check out these videos and check this out. Are you interested in medical coding but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. If you liked the content of this video, don't forget to let me know by hitting the thumbs up, hitting the subscribe button, and the notification bell so you are informed every week when I upload new content. I love hearing from you. So let me know you were here by asking a question, providing a comment, or just stopping by to say hi. You can also give me a little love by sharing this video on your social media platforms. Tag me in your video share at PRN Coding EDU. Let's stay connected and connect others. If you want to learn more about the wonderful world of health information, medical coding, and/or compliance, then watch one of these videos. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, and thanks so much for watching.